Desiree, thank you for sharing that. It's
It's my life now.
if I could wave a magic wand, I would wish kindness, and a lot of that would stop. And I'm going to try and get through this after hearing this story without tearing up, but no promises because I've already been there a few times tonight. Okay, let's see, where are we? Oh, no, come on. That's what I want. Yeah. Okay, so suicide and self-harm. Let's quickly have a look at. We're going to talk about non-suicidal self-injury. That is the technical medical term for self-harming, cutting, whatever you want to call it. And then also suicide. And in terms of this, I'm going to make a differentiation between non-suicidal self-injury and suicidal self-injury. And as you'll see, there's overlap. There's distinct differences between the two, but there's also a lot of overlap, and there's a lot of going from one to the other often for kids. So we'll have a look at that and kind of see how that all fits together. We'll look at the incidents, and the numbers really are scary if you look at what's happening. Not just now, but over time. Talk about some of the risk factors. What are the things that get people to that point where they consider self-injury, whether non-suicidal or suicidal? And then what are the risk factors? What are the protective factors? What is there that protects people from getting there? And then what can we do? How can we help? How can we strengthen our kids? How can we make them more resilient? And what can we as parents and as a community offer to keep them safe? So we'll look at definitions in a second, but for a person to get to that point where you are considering to end your own life is a very, very drastic step. It takes a lot of, nobody just goes from I'm okay to I'm contemplating suicide. There's a whole process that you go through. Non-suicidal self-injury is different. And essentially, the difference between the two is the intent. With non-suicidal self-injury, your intent is to feel better, to punish yourself, but not to end your life. It is to alleviate suffering. With a suicidal self-injury, your intent is to end your life. So although the pathway to both are different, by repetitive self-injury, you are opening the pathway to suicide, because you're getting closer and closer and closer to that point where harming myself is okay, harming myself makes me feel better. At some point, harming myself means I can end it all. And that is not the pathway for everybody, but that is a definite risk if you have a child who is engaging in repetitive non-suicidal self-injury. So, according to the DSM-5, the Diagnostic and Statistical Manual, 5th edition, it is the psychiatric Bible that defines everything that we as psychiatrists do. Those are the definitions of the two. As I said, non-suicidal self-injury is the intentional engagement in self-administered bodily harm without the intent to cause self-death. And with suicidal self-injury, you're setting in motion a set of events that could lead to your eventual death. And we'll have a look at what that means. So, oftentimes, a suicidal act is seen as a cry for help. And a self-injury act, a girl cutting, a boy burning, hitting the wall, is seen as attention seeking. That is not quite the truth. With both of those, with suicidal and non-suicidal self-injury, the motivation is intensely personal. It is not interpersonal. It has nothing to do, The people around you might lead you to that point, but that final act is not about showing something to other people. It is not about getting back at them. It is about what's happening in myself. With non-suicidal self-injury, typically the majority of people engage in it as a form of relieving emotional pain. I'm feeling overwhelmed by pain. I'm doing this physical act, and then I can live with the emotional pain because now the physical pain is much worse. For about half of people who engage in self-injury, it is also about self-punishment. I was bad, I deserve this, nobody likes me, therefore I must be bad, so I'm going to self-injure. For a very, very, very small minority, there can be an element of manipulation, trying to get attention, all of those things that we often think of that people want to achieve when they are self-harming. But that is really not the case. When it comes to suicide, it's a much more deeper felt feeling, and it's almost the absence of pain. It's hopelessness. You can't see a way out. In that moment, you are helpless, you are hopeless. There's absolutely no vision for you that things can change and that things can get better. And that leads to that suicidal act. Interpersonal, as I said, people don't commit, they don't engage in a suicidal act or go down that pathway because they're trying to manipulate people. Sometimes for very young children, they will express a wish to die because I want to show it. People will be sorry if I'm not here. But typically when younger kids engage in that kind of wishful thinking, they have no clear concept that death is permanent. And they're saying this, but they're also thinking that next week they'll be back. And then everybody will be really sorry and will treat them a lot better. But in terms of teenagers, in terms of young adults, the motivation is usually not to get back at people. They're in that spot of there is no hope, there is no light. And Des is right. We need to get to them before they reach that point. Because when they reach that point, there is very little that anybody can do unless you're there in the moment and you can actually physically stop the act from happening. Now, this is kind of how it goes. So with non-suicidal self-injury, there's high negative affect, so high negative emotion. I'm anxious, I'm depressed, I'm sad, I'm hurting. Associated with low positive emotion, so things really seem quite helpless. That causes emotional distress, which then leads to the self-harming behaviors, and that releases the negative effect, and you feel better for a moment, for a day, for an hour, for however long, until that whole cycle starts up again. With suicidal self-injury, again, there's a pathway, and everybody doesn't always follow the whole pathway. And you can stop at one point and go back or go forwards, but essentially, the spectrum, right, of suicide thoughts is, I don't want to die. I'm not thinking of suicide. It's not on my horizon. I wish that I was dead. Life is hard. I wish I wasn't here. Maybe I should end my own life. Maybe suicide is an option. I have a plan. Then I set the plan in motion, and eventually that could lead to a successful suicide. It can move from one to the other. So you can have somebody who has suicidal thoughts at some points, self-injury at other times, and as I said, engaging in repetitive self-injury can lead you into that suicide pathway. People are often scared to ask somebody about suicide thoughts. There's that worry that I'm going to put the thought in your head. If I ask the question, I'm going to make it a possibility that you are going to think of. There's lots of research that that does not happen. In fact, the majority of people, when you ask them pertinently about suicide thoughts, feel a sense of relief that they can talk about this. Somebody cares enough to ask. So Des is right. We have to have those conversations with our kids. We have to ask. They're not all going to say that. And you can go through that whole circle from those suicide thoughts to an attempt in 10 minutes, 15 minutes. It doesn't always take days. It depends on where you're at and what's happening. So you could ask today, and the answer is no. And you can ask again tomorrow, and the answer is, yep, I've got a plan. But if you don't ask, you're not going to know. So, how big of a problem is it? Non-suicidal self-injury, 15 to 20% is kind of what the articles agree on. One I read this afternoon said up to 60% of teenagers engage in self-harm at some point during their adolescence. It typically peaks in mid-adolescence, so 14, 15 years of age is where this is the biggest problem. And then in young adulthood, it tends to usually taper off. Boys engage in non-suicidal self-harm as much as girls do. It's different in how they do it. Typically, girls cut. Boys hit things, burn themselves. They might go out and get on a dirt bike and see if they can crash it, right? Not necessarily because they want to die, but because they want to feel hurt. Girls are much more likely to be hospitalized. People are much more likely to recognize the behavior as non-suicidal self-injury and try and get them help. A boy that hits the wall repetitively is seen as having anger issues. A girl who cuts herself is seen as having a mental health problem, and therefore we need to help her. The boy gets hit for hitting punching holes in the wall. The girl gets help for cutting herself. So it is important to realize that there are differences. So between the ages of 10 and 19, 72% of people who are hospitalized for non-suicidal self-injury are girls. In the young adult population, 58% are female. So then you're starting to see that discrepancy disappearing.
Can I ask a question?
Yes.
Would drinking or drugging to excess be self-harm in this case?
It can be,
Okay.
right? It depends on what the intent is. If the intent is to numb feelings, to alleviate emotional pain, absolutely. Okay, so if we look at suicide numbers, right? For every completed suicide, there are 5 suicide-related admissions into a hospital. There are 25 to 30 attempts that do not need hospitalization. And at least 7 to 10 people are profoundly affected by a suicide loss. I never knew Jaden. I do know that he had a big influence on a lot of friends and peers. And his passing touched a lot of the kids that I see. And a lot of them really struggled to deal with that and everything that went around it. So I know he had a big impact on a big group of kids in Lloyd. Approximately 11 people die in Canada every day of suicide. That is a scary statistic. That's 1 in each province every day. If you look at completed suicide rates per age group, our kids are not the highest group of people committing or attempting suicide, but that is a significant number of kids, right? And the scary part of this graph, that's the 2016 graph. The 2018 graph, which is the latest one, I couldn't get it to go into my PowerPoint, it's still protected by copyright, doesn't look much different. The 2010 one doesn't look much different. We're not doing a very good job of preventing suicides in our young people. In children and youth, and young adults, suicide is the second leading cause of death. The primary cause of death is accidental injuries. So the top two reasons that our young people are passing early are violence, right, of some kind, either self-inflicted or accidents, car accidents, boating accidents, drunk driving. That is something that we can change. We might not be able to cure cancer, we might not be able to stop COVID, although we're trying, but we can do something about suicides and about those accidental deaths. Between the ages of 10 and 14, boys are about 41% of people who successfully commit suicide. After that, it goes up to 70%.
I find this during puberty.
Yeah.
From about 12 to about 17 years old.
One of the risk factors for suicide attempts is impulsivity. And in teenage years, your impulsivity increases. So absolutely. And boys are more risk-taking. They're less harm avoidant, they're more risk-taking. And then the other big factor that plays into that is the choice of method. Boys are much more likely to pick more violent methods to try and end their lives with. If you take an overdose of pills, you've got time to get to a hospital, you've got time to, people have time to intervene and do something. If you hang yourself, if you shoot yourself, there's not much time to do anything about that. And boys do tend to pick the more violent methods. Girls are more passive and will try and find ways that are less violent. Okay, so what are the risk factors? Mental health, psychiatric problems, absolutely. That is a big risk factor. As Des pointed out, not everybody who commits suicide has a mental health problem. Feelings of hopelessness, helplessness, being in a situation where you cannot change what's happening to you, right? Being disempowered, feeling that I have no control over what people are saying. And rumors are very, very scary, because what do you do about a rumor? If you deny it vehemently, that's not true, I didn't do it, you're talking nonsense, there's going to be a group of people that say, he or she is protesting way too much, there must be something to this. If you ignore it, then it can just keep on going, and you can ignore it, but other people will keep on stoking it. So rumors disempower kids to a big extent, because you really are helpless in doing anything about that. Bullying absolutely is a risk factor for any kind of self-injury. High impulsivity, that, as I said, it happens in teenage years. Ambivalence about how you fit in. And there's a lot being written about our non-gender conforming youth, right? The kids that just don't fit in, the kids that are thinking that they are homosexual, the kids who think that they're different gender, the kids who just don't feel like they fit in with their peer group for whatever reason. I live in Maidstone and I don't play hockey, so I'm not cool because I don't play hockey. Kids that don't fit in, and sometimes kids can fit in for a while, and then somebody decides something about them, and if that person is more popular and has more power, it can change that dynamic, and now the kid finds himself on the outs with a group. Exposures to completed suicide, whether that is somebody that you know, somebody in the community, a family member, media exposure. Again, there's touched on that whole media piece of it. Our kids are very connected to media. Hearing about suicides on the news can trigger the thought that that is a possibility, especially if you identify with a person or with a story that they are telling. There was apparently, I didn't see this, thank goodness, I didn't look, but I don't know if you heard that on TikTok there was a video a self-recording of somebody apparently committing suicide. They have removed that since, but I can promise you millions of kids watched that before it was removed. Shows like 13 Reasons Why. There was a definite upsurge in suicide attempts and completed suicides following the first season screening of 13 Reasons Why. You all know what 13 Reasons Why is about, right? Okay. So, exposure is a very important factor. Previous non-suicidal self-injury or suicide attempt. Every time you try, it becomes a little bit easier to go down that pathway again. So, it is not true that anybody who tries once is going to commit suicide. It is not true that everybody who self-harms is going to end up committing suicide. But it is a warning sign that you need to be aware of what is happening here. A history of abuse, that one is a little bit problematic. Some people say it is a uterus factor. Other studies say no, it doesn't. What does seem clear is that the type of abuse is important. And although sexual abuse and physical abuse lead to post-traumatic stress disorder, anxiety, depression, emotional abuse is the one that is most linked to suicide. So again, that emotional piece, that breaking down of who you are as a human being conveys the biggest risk factor for later completed suicides. Access to lethal means. And we'll get to that when it comes to prevention. One of the most effective ways of decreasing completed suicide rates is lock up guns, right? Try and it is impossible to suicide-proof a home. It is just impossible, right? If you've tried, I hope that you manage to stop something, but it is impossible. But locking up guns, right, makes a huge difference. Where there are certain areas, certain bridges that people tend to go to commit suicide, where they've blocked access to those bridges, where they've blocked access to people being able to get there, that has an effect. So, if you can't access a lethal means, you might still try, but there's a chance that somebody's going to get to you in time and that you can be helped. And then, as I said, media exposure. Yeah, okay. So what protects family connectedness? Talk to your kids. Have those conversations. Know who their friends are. Have supper together as often as you can. I know all our lives are busy. I know everybody is doing things, and kids have hockey and parents are busy and life can get hectic. But sit down together, have a meal, look at them, look them in the eye, because then you can pick up when something is wrong. And if you never have conversations with your kids when they're little, your teenager is not going to come and tell you that there's a problem. If you overreact and get mad every time they say that something happened, they're not going to come to you and say, Mom, Dad, I'm really in trouble. So have those conversations. Try and stay calm. If you want to explode, make the excuse, go to the washroom, explode, and come back and then talk to them calmly about whatever the issue is. They need to know that they can trust us. They need to know that they can come to us as their parents with anything. And we are going to try and deal with it and help them deal with it in the best way that we can. A positive school environment, right? Having teachers that believe in you, being academically successful, and not just being an honor student, but having people recognize when you've tried, having people recognize the effort. If 60 is the best that you could do with as much hard work as the kid that got 90, you should get credit for that 60. Working on peer relationships, right? Helping kids understand that it is not okay to send that message to that person even though you're mad at them. Think about it. Don't tell them tomorrow face to face. Do not send it to the whole world. Good self-esteem and a sense of self-efficacy, a sense that I can do things. I have a say in my life. And as we heard from Dave, Jaden had that. Up until that last minute where it was stripped from him, right? But if kids believe in themselves, if they know that they can advocate for themselves, if they know that they can make a change in their relationships, in their environment, that is a huge protective factor against self-harm. And having someone or something to care for, having a cat or a dog or a fish that relies on you to feed them, right, can be a deterrent. Knowing that mom and dad love me. If you look at, in studies that they've done, in talking to people who have aborted a suicide attempt, or people who have gotten to that, they've planned everything and then they stop, they don't go through with it. One of the most important protective factors is the thought that there are people that care for me, and there are people that are going to be very, very hurt if I go through with this. So much as a suicide attempt is not an attempt to manipulate other people or to get something from other people, the knowledge that I am loved, I am cared for, there are people that are going to be really, really hurt by this, is a big deterrent for people if they can still think about that, if there's still a little bit of logic left in their reasoning process. Okay, so how can we prevent suicide? Well, that's the million-dollar question. As I said to you, the statistics show that we have not done a very good job of it up until now. In any prevention effort, they talk about universal prevention. So that is efforts at preventing a problem in the whole community. And individual or specific prevention, which is aimed at a specific person. The universal methods that work is limit access to the more lethal methods of suicide. Keep medications that you know are more deadly locked up. If you've got guns in the house, lock them up. Preferably lock the ammunition up somewhere different. Cars, I don't know. There's a lot of ways that kids can keep them away from the internet. I think if you go and research suicide methods, it is scary how many methods there are. And if you do put in, I have to give Google the credit here. They have changed it, but nowadays if you Google suicide methods, you get, the first few sites that you get are where to get help. It doesn't need to be this way. You're not getting a handbook on how to do this. But if you dig a little bit, there are handbooks on how to do this. School-based awareness programs like the SHINE program that works on emotional intelligence, on kids being kind to each other, on being able to talk about your feelings. Those help, right? They make a difference. Promote awareness of helplines. Let kids know if you're in that point, you can call, you can get help. Those numbers are hard to remember, but they are there, right? We are going to post this on the Facebook page, so if you don't want to remember the numbers, you don't have to. And then more specific, treat mental health disorders when they are there, right? The mental health disorders that are most linked to suicide or to self-injury are depression, anxiety, personality disorders. By treating those, you can make a difference, right? And treating them does not necessarily mean let's medicate our kids to their eyeballs, right? Talk to a counselor, get some cognitive behavioral therapy, just talk to somebody, be aware that there's a problem, right? And treat them. Dialectical behavior therapy is a type of therapy that was developed specifically to treat patients with borderline personality disorder. It is the only specific therapy that has a proven effect on decreasing non-suicidal self-injury. And essentially what it does is it aims at helping people identify negative thoughts, negative emotions, and teaching them how to deal with that, and teaching them how to deal with interpersonal conflict. So much like cognitive behavioral therapy, except that it's much more emotion-based and based on interpersonal relationships. that can be useful. So, in conclusion, non-suicidal self-injury is a warning sign, right? It's a kid saying, I'm in trouble, I'm feeling pain and I don't know how to deal with it. Well, I do know how to deal with it. I deal with it by self-harming, but they probably need some other skills. They probably need some other interventions to help them deal with it in a better way. Suicide is a tragedy. Every kid, every person that we lose to suicide is a loss of potential, is a loss of a family, is a preventable tragedy 80% of the time. And unfortunately, as the statistics show us, there's always going to be a group that we just cannot reach, that reach that point and there is nobody there, and we're never going to be able to stop all of those tragedies, but that doesn't mean we can't try. Okay, there's some resources, and as I said, this will be up on the website. Any questions, comments, discussion? Please. The idea of the support group is that we can talk about things, right? We want to create a community where people can get together and talk about things and support each other and help out when life is really difficult, and maybe get some sustenance from somebody else that says, you know what, I've been there, I get it.